So our 9:30 session asked the question, is digital health here to stay? After all, medicine is a high-touch business. It can be pretty emotional territory, whether people are coping with being sick, or if they or if they're what we sometimes call the worried well. People need information they can trust and reassurance they're going to get better and stay healthy. What are the ways that digital health technologies can change our health system for the better, but still contribute to the human side of the equation over the long term? Next up, we're quite fortunate to have some of the industry's top experts here to take a deeper dive into many of these issues. Our speakers this morning represent some of America's leading health, retail, and technology companies. They're going to give us their take on the big picture for the digital health prospects for the future. Our moderator is Dr. Cheryl Pegus, Chief Medical Officer for Walgreens. Dr. Pegus joined Walgreens in May. She has nearly 2 decades of clinical practice and industry experience. Before joining Walgreens, she was General Manager and Chief Medical Officer for SimCare Personalized Health Solutions and held several senior positions with Aetna, including Head of Clinical Business Products for Aetna's Medical Products Business Unit and National Medical Director for Women's Health. She also served as Medical Director for the Cardiovascular Risk Factors Group at Pfizer. So with that, I turn the reins over to Dr. Pegus. Oh, do I have to get this up? Sorry. Take your water.
Good morning, everyone. You know, the title of our panel is Digital Health Here to Stay. I think our keynote speaker just totally nailed that, right? It's here, it's staying, it's now. How are we all going to implement and execute on it? In the next hour, we, the panelists, representing different parts of the healthcare industry, will discuss our companies, our use of digital health tools, and the important role it has in providing easy-to-access healthcare, measurable healthcare, and cost-effective healthcare. Some logistics. Each of our panelists will have 5 minutes to share what healthcare services are enabled by digital health and how it's important in acute as well as chronic care. We will then answer some prepared questions, really looking at healthcare, digital health today, how it's being utilized, and what we see coming in the future. We will then go ahead and take some questions from the audience. So hoping to have maybe 20, 25 minutes of us not only talking about our businesses, also answering some prepared questions, and really want to hear and interact with the audience as well. Without further ado, I'd like to introduce my wonderful panelist. And I have to thank everyone for our plush, comfy chairs. Weren't expecting them as we came up. Yeah. So to my right is Harry Greenspun. He's the Chief Medical Officer for Dell Services. Enabling healthcare reform. He provides strategic leadership with a clinical perspective. He's made recommendations to the Obama administration and Congress on the importance of health IT, giving him a unique perspective on the challenges and opportunities faced in healthcare IT. As chairman of the Health Information Management Systems Society HIMSS Government Relations Roundtable and co-chair of HIMSS Task Force, he's responsible for creating the white paper entitled Enabling Healthcare Reform Using Information Technology. He's made recommendations to the Obama administration and Congress on the importance of health IT and the investments in the nation. To his right is Martin Harris. He's the Chief Information Officer and Chairman of the Information Technology Division of Cleveland Clinic. Additionally, he's responsible for strategic business planning for Cleveland Clinic. He was appointed to the U.S. Department of Health and Human Services Health Information Technology Standards Committee. He's chairman of the board of HIMSS. He's a presidential appointment to the Commission on Care for America's Wounded Warriors. And he's a former advisor to the director of the NIH. And last but not least is Dr. Migliori. He's Executive Vice President, Business Initiatives and Clinical Affairs of UnitedHealth Group, and has another job at UnitedHealth Group. He's Chief Healthcare Officer of UnitedHealth Group Alliances. He's responsible for ensuring clinical excellence and linking that excellence to practical clinical outcomes and robust business cases. He serves as the Chief Healthcare Officer of UnitedHealth Group Alliances, which is a division of Ovations, and he's responsible for the healthcare transformation on behalf of AARP. We've each prepared some information on each of our companies that we'll go through with you. At Walgreens, we look at healthcare as accessible healthcare. And what I'd like to share with you is how we're using our retail footprint to provide not just the products and services you can get on our Walgreens shelves, but also provide true healthcare services integrated to your physicians, your health systems that you may seek care from, and also at home. We've got a lot of locations, a lot of real estate where we are. 2/3 of Americans live within 3 miles of Walgreens. Something we're very proud of as you talk about healthcare access is that 43% of the U.S. population in medically underserved areas are also close to a Walgreens. So just think of that as a destination for providing healthcare, especially as we think of healthcare shortages in providers. You can go online. We've already talked about everybody's got a smartphone. And I want to stress, even in medically underserved areas, there may not be a lot of physician practices, but everybody's got a cell phone. And so you can schedule your prescription pickup, and we're seeing increased growth here for us as a business. As everybody else, we've got a lot of apps on different phones. We've got an iPhone, Android, and a BlackBerry app. And you can download some of these apps, so again, making it easier for you to refill your prescriptions. We text message you. You heard a little bit about that from our keynote also, giving text messages to remind people when to come back for their prescriptions, giving text messages if their physicians have sent them a new prescription, checking to make sure that there are no drug-drug interactions. We do that today for the people who utilize our services. And then we provide care. Besides our pharmacist, we also have nurse practitioners at our pharmacies in our Take Care clinics who treat patients for many different healthcare services. And we'll talk a little bit about how our electronic medical record integrates and allows them to take information back to their physicians and also to health systems as needed. We also, and I think many people are unaware, Walgreens has one of the largest employer health clinic networks in the country. Yesterday, we announced our partnership with Intel, bringing our employer site clinic on site to Intel. So we have physicians, dentists, radiologists. For many of our employers, we provide full services to their employees. Some of the things that we do in helping people with medications, so yep, we're a big pharmacy drug train. If anyone should be helping to make sure that we improve our delivery of healthcare around medications and then measuring it, definitely Walgreens has been a part of that. We've got a number of different tools that we utilize. One of our biggest is making sure that physicians utilize e-prescribing in sending their prescriptions to their pharmacies. So many of us have talked about how physicians write. I want to say I actually have pretty good handwriting for a physician, but many of us have not spent a lot of time on that. And we all know that a prescription gets to the pharmacy, the pharmacist can't read it, and something else gets prescribed. The IOM Institute on Medicine talked about patient safety a lot and how e-prescribing, if only physicians utilized e-prescribing, probably a 20 to 25% decrease in hospitalizations, a really big deal as you tie it to healthcare cost. We also have a couple of tools that we utilize. If a pharmacist gets a new prescription and they're looking at it and they've got a history of what a patient has been on before, it'd be great to quickly look into a tool that tells you, does this interact with what they have? Can these patients drink grapefruit juice if they're taking Norvasc? So we're not asking pharmacists to keep going back to school all the